Gonorrhea is a common sexually transmitted infection, or STI. It affects millions of people worldwide each year, making it a significant public health concern. It's caused by bacteria called Neisseria gonorrhoeae. These bacteria are highly contagious and can be easily transmitted from one person to another. These bacteria thrive in warm, moist areas of the body. They find an ideal environment in the mucous membranes where they can multiply rapidly. This includes the urethra, cervix, rectum, and throat. These areas are particularly vulnerable to infection due to their moist and warm nature. Gonorrhea spreads through sexual contact. This means that anyone who is sexually active is at risk of contracting the infection. This can be vaginal, anal, or oral sex. It's important to note that all forms of sexual activity can transmit the bacteria. You can even get it through close genital contact without intercourse. This means that even without penetration, the bacteria can still be passed on. Many people with gonorrhea don't have any symptoms, which makes it easy to spread without knowing it. This asymptomatic nature is one of the reasons why the infection is so widespread. If left untreated, gonorrhea can have serious health consequences. It's crucial to seek medical attention if you suspect you might be infected. In women, it can lead to pelvic inflammatory disease, or PID. PID is a severe condition that can cause long-term health issues. PID can cause chronic pelvic pain and infertility. This means that untreated gonorrhea can have a lasting impact on a woman's reproductive health. In men, it can cause epididymitis. This condition is characterized by painful inflammation of the testicles. This is a painful inflammation of the testicles that can also lead to infertility. Men should be aware of this risk and seek treatment promptly. Gonorrhea can also increase your risk of contracting HIV. This is because the infection can cause sores and inflammation, making it easier for HIV to enter the body. Additionally, pregnant women can pass gonorrhea to their babies during childbirth. This vertical transmission can have severe consequences for the newborn. This can cause serious health problems for the newborn. Early detection and treatment are essential to prevent these complications. The good news is that gonorrhea is treatable. The bad news is it's becoming increasingly difficult. The Centers for Disease Control and Prevention, or CDC, recommends a dual therapy approach. This involves two antibiotics, ceftriaxone and doxycycline. Ceftriaxone is an injectable antibiotic. It's highly effective at killing the bacteria. Doxycycline is an oral antibiotic. It helps to prevent the spread of the infection and protect against other potential STIs. This dual therapy is usually effective in treating gonorrhea. However, it's important to take all of the medication as prescribed, even if you start to feel better. One of the biggest challenges in treating gonorrhea is the rise of antibiotic resistance. Over time, bacteria can develop the ability to survive exposure to antibiotics that would normally kill them. This resistance develops through natural selection. When antibiotics are used, they kill off susceptible bacteria. However, any bacteria with mutations that make them resistant to the antibiotic will survive. These resistant bacteria can then multiply and spread. This creates a population of bacteria that are no longer affected by the antibiotic. This is a major concern for gonorrhea treatment. The bacteria have become resistant to many of the antibiotics that were once effective. The good news is that scientists are working hard to develop new treatments for gonorrhea. This is crucial as the bacteria causing this infection have become increasingly resistant to existing antibiotics. This includes not only new antibiotics but also other types of antimicrobial drugs that can combat the infection in innovative ways. One promising area of research is the development of drugs that target different pathways in the bacteria. By understanding the bacteria's biology, scientists can find new ways to disrupt its life cycle. Instead of attacking the bacteria directly, these drugs interfere with their ability to grow and multiply. This approach can reduce the chances of the bacteria developing resistance. For example, zoliflodacin is a new type of antibiotic. It represents a novel approach in the fight against bacterial infections. It works by inhibiting the bacterial enzyme DNA gyrase, which is a critical component in the bacteria's ability to replicate its DNA. This enzyme is essential for DNA replication. Without it, the bacteria cannot reproduce and spread. Without the ability to replicate, the bacteria are effectively stopped in their tracks, preventing the infection from worsening. Zoliflodacin has shown promising results in clinical trials, indicating its potential effectiveness in real-world scenarios. If approved, it may become an important new treatment option for gonorrhea, offering hope to those affected by resistant strains. Another new drug under investigation is delafloxacin. This antibiotic is part of the fluoroquinolone class, known for its broad-spectrum activity. This is an antibiotic that belongs to the fluoroquinolone class. It works by inhibiting bacterial DNA replication, a critical process for bacterial survival. It works by inhibiting bacterial DNA replication. This means it can effectively stop the bacteria from multiplying and spreading. Delafloxacin has shown activity against a wide range of bacteria, making it a versatile option in the fight against bacterial infections. This includes some strains of Neisseria gonorrhoeae that are resistant to other antibiotics. This makes delafloxacin a valuable tool in the ongoing battle against antibiotic-resistant infections. The importance of completing your antibiotics. It's crucial to understand that completing your entire course of antibiotics is essential for preventing antibiotic resistance. Antibiotics are powerful medicines designed to fight bacterial infections, but their effectiveness depends on how they are used. When you don't take your antibiotics as prescribed, you're essentially giving the bacteria a chance to develop resistance. This means that the bacteria can adapt and become stronger, making the antibiotics less effective. Here's why. When you start taking antibiotics, you kill off the most susceptible bacteria first. These are the bacteria that are easiest to eliminate. This can make you feel better quickly, often within a few days of starting the medication. However, some bacteria may still be alive. These surviving bacteria are usually the ones that are more resistant to the antibiotic. These are the ones that are more resistant to the antibiotic. They are tougher to kill and can survive the initial treatment. If you stop taking your antibiotics too soon, these resistant bacteria will have a chance to multiply. They can grow and spread, leading to a more severe infection. This can lead to a resurgence of the infection. The illness can come back often worse than before. This time it will be caused by bacteria that are more difficult to treat. These resistant bacteria require stronger, more potent antibiotics, which may have more side effects. Always follow your doctor's instructions and finish the entire course of antibiotics. This ensures that all the bacteria are killed and reduces the risk of resistance. Even if you feel better before you've finished all of the medication, it's important to continue taking it until it's all gone. This is the best way to protect your health and prevent antibiotic resistance. Preventing reinfection, a shared responsibility. Preventing reinfection with gonorrhea is a shared responsibility. It requires open communication with your partner and responsible sexual behavior. If you've been diagnosed with gonorrhea, it's important to abstain from sexual activity until you and your partner, or partners, have both completed treatment. This will help to prevent the spread of the infection and reduce the risk of reinfection. Using condoms consistently and correctly is one of the most effective ways to prevent gonorrhea and other STIs. Condoms act as a barrier. They prevent the exchange of bodily fluids during sexual activity. This significantly reduces the risk of transmitting the bacteria that cause gonorrhea. While gonorrhea can affect both men and women, it often presents differently in men. Men with gonorrhea may experience a burning sensation during urination, white, yellow, or green discharge from the penis, and pain or swelling in the testicles. It is important for men to seek medical attention if they experience any of these symptoms. Untreated gonorrhea can lead to serious complications in men. This includes epididymitis, which can cause infertility if left untreated. Gonorrhea and women, understanding the risks. Women with gonorrhea often experience mild or no symptoms. This can make it difficult to detect and treat early on. When symptoms do occur in women, they may include increased vaginal discharge, painful urination, and bleeding between periods. Untreated gonorrhea can have serious consequences for women. This includes pelvic inflammatory disease, or PID. PID is a serious infection that can cause chronic pelvic pain, infertility, and ectopic pregnancy. Regular STI testing is crucial for women even if they don't have any symptoms. Public awareness. Raising public awareness about gonorrhea is crucial. We need to promote early detection and treatment. Public health campaigns can educate people about the symptoms of gonorrhea. They can also stress the importance of regular testing and safe sex practices. These campaigns can target specific populations who may be at higher risk of infection. Reducing the stigma associated with STIs is also essential. People should feel comfortable discussing sexual health with their partners and healthcare providers without shame or embarrassment. Open and honest conversations about sexual health can encourage people to get tested and treated promptly. This helps to prevent the spread of infection. Conclusion: protecting yourself and others. Gonorrhea is a common and treatable STI. However, the rise of antibiotic resistance poses a significant threat to our ability to control this infection. It's crucial to practice safe sex, get tested regularly, and complete any prescribed course of antibiotics. We can all do our part to protect ourselves and others from the spread of gonorrhea.